Welcome to this AJR Insider video. I'm Andy Rosenkrantz, Editor-in-Chief of AJR, and I'm here today with Dr. Eric Chang, Professor of Radiology at UC San Diego, who is editor of our Musculoskeletal Imaging Section. In this video, he'll be sharing with us his insights about the area. Eric, thanks for joining us.
Thanks for having me, Andy.
Can you tell us about your background in musculoskeletal imaging?
Sure. Like so many other musculoskeletal radiologists, my interest started early on through interactions with orthopedic surgeons. Up until the very end of medical school, which was at NYU, I actually thought I was going to be an orthopedic surgeon. But at the very last moment, I decided that operating on patients wasn't my true calling. I had extremely strong mentorship throughout my career, including during medical school, first in orthopedic surgery, and as I found my way towards musculoskeletal radiology. I did my residency at UCSD and was surrounded by some of the best faculty, and in particular musculoskeletal faculty, that one can imagine. It was an easy choice for me to stay in academic medicine. I often say it's better to be lucky than good, and when it comes to finding the best mentors and ultimately the best job that anyone can imagine, I'm incredibly lucky. Over the past dozen or so years, between 1/3 and 3/4 of my time has been research funded. The research I'm involved with spans the gamut, from molecular and in vitro to preclinical with animal models, all the way to human imaging studies with multimodal. This means every day is different and every day is exciting.
That's great. Let's move on now to the journal section. What trends have you observed for recent AJR submissions in the area?
Over the past 4 years, there's been a noticeable increase in the general quality of the submissions we've received. For original research, there has been an increased percentage of manuscripts with stronger methodologies. One example would be for diagnostic accuracy studies. We now routinely see studies that have multiple independent readers incorporated into their study design, with complete reporting and analysis of those results. For studies using AI tools, it's increasingly common to see external validation. These are just some examples that speak to the higher bar that is required for publishing nowadays. With regards to topics that we've seen, some relate to improvements in technology. For example, what we can do with photon counting detector CT, or using accelerated acquisition and applying novel reconstruction algorithms to MRI, and how this might affect radiologist interpretation. Musculoskeletal interventions were another hot topic in more recent years.
And what do you see as areas of priority for publishing an MSK over the coming year?
We're going to continue to prioritize clinically useful articles for busy radiologists. The topic has to be relevant to most radiologists' daily work. It can't be so esoteric that a private practice radiologist reading at high volumes won't encounter that entity over several years. We like seeing new technologies, but the manuscript should be focused on the clinical relevance rather than the technical aspects. We don't have particular areas or topics that we're pushing for, but as we are all practicing radiologists, we know what clinically impactful work is, and this is what we prioritize.
Are there tips that you have for authors looking to publish an MSK?
Our two main article types in the musculoskeletal section are original research and review articles. For original research, we have an outstanding author guide on the AJR website where tips are provided for all sections, from the title to the abstract, all the way to the mandatory sections of the manuscript, which would include the introduction, the methods, the results, and the discussion. These tips should be helpful for authors submitting to all imaging journals, not only AJR. For original research, an aspect of novelty is helpful. If the research topic has been published several times before and the current manuscript just confirms these findings, this would be considered lower priority. Of course, if the current manuscript has many times more participants than one single study previously, and if it found something very different, such as possibly a negative result, this would have higher priority. For review articles, the topic is the most important predictor of successful publication. There should be fairly new or updated material included in the review article or a fresh take on the topic. Review articles in AJR are not comprehensive book chapters, or as we like to call it, enjoyable refreshers on already well-known topics. It's important that you be objective with your own work, and if you can, solicit the opinions of your colleagues or friends. Of course, they'll be busy like everyone else, and if they can't find the time to read your manuscript based on the topic, then it's often telling that other AJR readers would be similar. Or they might be honest with you and tell you that it was difficult to read through, either because it's too dense or doesn't flow well. Overall, getting more eyes on the manuscript can be very helpful.
Those were really good insights. Are there other common pitfalls that you're seeing in submissions?
I think the most common pitfall we see in submissions in the musculoskeletal section is that the work doesn't fall within the journal scope. For example, if the work is too niche and not particularly relevant to the general radiologist, this wouldn't make it past the initial triage, and it would be better suited for a subspecialty journal. Along similar lines, technical work with phantoms and no human subjects would typically not fit well with the journal. For work including AI algorithms, the manuscript should be focused on the clinical aspects and not just the technical aspects. For these type of studies, the code should be publicly shared, and we do scrutinize the methodology. For example, we pay attention to the potential biases in case selection, as well as making sure there is a clear delineation between the training and validation data. Within the original research manuscripts themselves, I think there are two common pitfalls. The first is not having a logical order for the inclusion and the exclusion criteria. From the very beginning, every step should be adequately described, and the number of patients should be listed, as well as the number of patients that are included and excluded, all with a very logical flow. A second pitfall is where we see there's new information that's about the study sample that's first presented in the discussion. This should be mentioned in the results section, of course, with a corresponding description and the methods on how that was generated.
And anything else that you'd like for our listeners to know?
We'd like for authors to know that the editorial board at the AJR take the submission and review process extremely seriously. All new submissions are read word for word, even in the triage stage. This happens on a daily basis, 7 days a week, 365 days a year. For those manuscripts that make it through the review process, they've had many pairs of eyes on them, including the reviewers and the editorial board and staff. Typically, all of us make multiple passes. It's been an incredible pleasure for me to be a part of the editorial board of AJR over the past few years, and I've learned so much from reading the manuscripts and reviews, as well as interacting with you, Andy, and other editorial board members.
Eric, thanks for joining us.
Thanks for having me.